So today we're talking about mindful or mindful, and we're looking at women veterans in a cohort study here at Fieldstone in a partnership with Case Western. Your picture didn't come through.
That's all right.
Oh,
You can see.
you get the real thing. So I'm wearing my program director hat today. I was on the ground and I was the facilitator in this women veterans group.
I was the kind of person associated with the research infrastructure responsible for IRB clearance, consultation on design, sampling, statistical analysis, dissemination, and we hope ongoing funding. Not that I was successful in all of that. However, I was a resource person.
I would say successful. So this was an exploratory study to start with, and we were working to identify whether or not the women's perception of their mindfulness changed over time through their partnership in this Equine-Facilitated program. We did, long story short, I'm going to give you the finding right up front, we did find a significant change in their mindfulness. That they did increase in mindfulness skills and self-perception of mindfulness through this intervention. Okay, we're done. No, I'm kidding. So I want to go back to just a definition real quick. What we're talking about when we say equine-facilitated therapy, because language is everything. So this was truly a social work intervention. So this group is through the VA here in Cleveland. You know them all too well. They are a day program, so the women come in. They are a cohort model, so they rotate through, but we knew who would be coming to us. They are part of a structured program, and so they know that they're coming here as part of their treatment plan. It is a substance use recovery program. They have other diagnoses potentially as well. We have that information. We are not involved in, it's not a fix, right? This program is not a fix. It is a skill development program. So the VA is doing the substance use recovery, and we are doing skill development here. So that's a really important piece that we're teaching. So we're teaching a mindfulness skill, and we're working with their social worker. So I am a social worker by training, but my role here is as the equine specialist. So we're using that diamond model of the equine specialist, the social worker, the client, the horses. And we are really benefiting from the horses as the grounding mechanism to teach mindfulness-based stress reduction. Questions there? Okay. We use a very scripted 4-session plan. This is literally laid out in the paper. I'm happy to share the paper. It is published. I believe it is open access. If it is not, I will make it open access for you. It is open. It is open access. It is literally scripted out. When we say in session 2, breathe with, I'm going to jump down to that for a second. This is an example of breathe with. Okay, so we'll talk about that. So in session 1, we come in, we do a tour of the farm. It is important for veterans to know their environment. It is important for anybody to know their environment, right? Where are the entrances and the exits? Who's around you? Where are you safe? Where is water? Where can I sit down, right? So we always start with a tour. Names, helmets. That is its own thing. Helmets can be incredibly triggering to anybody, and especially, Chris is shaking her head yes, and especially in a population where that may bring back memories. So we literally go slow and steady on very specific elements. We do a herd observation. We set 3 goobers loose in the indoor arena, and we talk about herd dynamics, right? And we do it both in terms of a little bit of this is the word I always trip myself on. Or anthropomorphism, thank you, and horse behavior, right? Some people come in with some horse experience and some do not. And so we do a little bit of both. Who's the leader? Who's the follower? You know, who's demonstrating some independence right now? So we kind of go through all of that. And then they groom in the arena. So we put the halters on. We have our instructors actually come in, put halters on the horses. Then the volunteers will hold them, and we teach how to groom safely with volunteer support. That's all session 1. 2, 3, and 4, you see we always start with grooming. We pick our space based on really the needs of the group. So if you think about the grooming bays, they might feel enclosed, or that might feel really good, right? So our space can change, but the activity doesn't. So we might groom in the arena altogether, or we might groom in the grooming bays. But we check in the classrooms first. Some of you that went on the tour with me heard me say all of our veterans programs start and end in classroom 2. We always do that. Start in classroom 2. Say, okay, do we want to start in the grooming bays, or do we want to start by grooming out in the arena? So there's choice, but we start with grooming. Then we do breathe with. She's just a little short here. She's not a veteran. But breathe with is taking one arm up and over, one arm down and under, getting your chest as close to that horse's kind of armpit area to really feel their respiration. You're doing 3 things. You're getting that tactile sensation and giving your body weight to the horse, right? You're feeling their warmth, and you're trusting that they're holding you. So there's trust, there's warmth, and then you're feeling their respiration rate and trying to get your respiration rate to match theirs, which is inevitably, hopefully, a little bit slower. So I can actually say to somebody, it seems like Smoke isn't standing quite still right now. He's pawing at the ground. What can we do to help Smoke settle, right? Take a deep breath. Smoke is really good at reading people. He's my go-to horse for this. He will take that breath, and then he will settle, right? Romeo will pace, and he'll do this back and forth and dance until somebody settles. And I'm fine, I'm fine. Really, are you fine, right? I don't have to call anybody out. No, you're not fine, right? I can say, okay, you're fine. He's not. What can you do to help him settle? And so we get there together, right? So we do breathe with so that we start to practice some internal, external grounding. Those of you that have the coping cards, there's an activity in there called internal, external. So it's moving from what's going on outside of me, what's going on inside of me, what's going on outside of me, what's going on inside of me. That's breathe with. Then we do session 3, grooming and carry your burdens. This is a really fun activity. If you have a social worker involved in a session with you, I encourage you to do it. If you don't do it. It's Pandora's box. So just... there you go. So you have everybody in the room. They write down things that are stressors to them on Post-it notes. Nobody's going to look at these Post-it notes except for them. Nobody. They write something down on each Post-it note. They tape it to a beanbag. Then we go out in the arena and we groom. And then as they're finished grooming, they all work together. The volunteers hold their horses and they set up an obstacle course. And then they get so excited because they're going to go through the obstacle course, and they take their horse and they get ready to go. And the only lesson that they have to do is they have to keep moving forward. That's the only rule of the game, is keep moving forward. But as they get ready to go, I hand them back all of their bean bags. And they look at me like, you crazy human, I'm leading a horse. And I go, but they're yours, go. You got to keep moving forward. And I don't want them. I'm leading the horse. Okay, well, go. They're yours. Where am I going with this? Drop them. What else? What else do you think people do with them? Throw them. What else do you think people do with them?
Give them to your social worker.
Give them to your social. Yeah, I like that. Give them to your social worker. What else do you think people do with them?
Put them on the horse.
Put them on the horse. Yep.
Carry it with them.
Carry it with them. I have seen women stick them in their bras and their pants and in their, because they're not ready to let go of them. I've seen people drop kick them. I've seen them strategically place them into piles of manure, right? Well, these are their burdens. What does that say about their burdens, right? That they're not ready to let go of them, that all they want to do is get rid of them, right? There's all of this kind of metamorphic, that's not a word. Metaphorical, there we go. I was going to add syllables to that word. That we can really, so I do the work of the activity, and then I look at my social worker and go, your turn. And at the end of the activity, the most important piece, and this is in the paper, is the social worker goes around and picks up every last beanbag. Every last beanbag. I don't care how far it got drop kicked. Because she's showing that as long as they're in the program, she's got them. They are not responsible for their burdens on their own. And she picks them all up, and then she takes all of those little Post-it notes and she tears them up because nobody's reading them, and we throw them away right in front of them, and we put the beanbags away, and we use our hands to love up on the horses one more time and put them back. And it is one of the most impactful drives back to the VA. All the time. Right? And the last one is we go out on a nice trail walk. So we have those mile trail walk. We just go out and we go for a walk. And that is where people start to process and talk and unwind, and they're, okay, I get it now. So in these sessions, we have seen change. And we noticed anecdotally change. And to Chris's point, we needed to publish this change, right? So we decided to do the research behind it. So we did a lovely little lit review. And out of everything in the literature, we found 3 comparative empirical papers. 3. So what we were able to deduce down to is we needed to have some reliable measures. There were no consistent measures in the prior literature. So what we decided to use is the Toronto Mindfulness Scale, so we could see where were the women coming in terms of their mindfulness, and then using something comparable to the Frankel scale, which is like that face scale, you know, how happy are you right now, right? Using a temperature scale when they come in and when they leave. Where are you at now? Where are you at now? And they could rank just where they are. That's what we did. Those were our measures. They're valid and reliable scales. They're self-report. And then at the end, we did a program evaluation. We also did do a program evaluation of the men who also go through the same program that are also in the VA in a different department. The men's group did not allow us to do research, so that is not part of the IRB, that is not part of the findings, that is not part of the paper, but they do the exact same 4 lessons. It is included in a program evaluation, not included in the research. Different discussion. Partnership. So, couldn't have done this without the VA, obviously. It's a very specific department within the VA. The women are all honorably discharged under general conditions. They are part of a very specific program, and they come in utilizing a team approach and specifically working on mindfulness, connection, self-confidence, and self-esteem. Kind of a perfect partnership, wouldn't you think? And then we were able to utilize team building as kind of the core program and the core theme that we were working through. So we used a mixed method study design, pre and post, and we were exploring the perceptions of mindfulness for the female veterans. We had this structured EFT curriculum delivered by a credentialed professional in a Premier Path accredited center. And overall, in 2019, we had 114 veterans served. Of them, 29 participated, predominantly because we were looking specifically the female veterans in this specific program. All had scored greater than 1 and less than a 2.5 on the Toronto Mindfulness Scale. So all of them had some cognizance of what mindfulness is and where they felt that they had some skill, but not a whole lot to start off with. Curiosity was a little bit higher, and the construct of decentering was a little bit lower. Those are the 2 constructs measured by that scale. Overall, the mindfulness survey itself, the women ranged from a 2.3 to a 6.5 in terms of their self-perception of mindfulness. So some were like, I'm all right, I'm doing okay, I'm over the average of 5, right? And some were like, mindfulness, not my game. Post-intervention, we went to 6.7 to 9.2. That's pretty awesome. That's just looking at means, right? There was a significant difference in the scores from pre-intervention to post-intervention. So both in terms of just looking at raw data and then statistically, there was a difference for their self-perception of mindfulness. And we did this through a, paired sample t-test. One of my favorites was, the horses have taught me a lot about myself. So when we, again, thinking about this group of female veterans that are going through a substance use treatment recovery program, right, who have compounding issues, when we really break down who is in that population and what are they working through and what are the challenges, right, they're being vulnerable enough to relearn who they are and who they want to be, you know, in the beauty of horses, right? And that wasn't happening in other forms of interpersonal therapy. That was happening here, right? To me, that's huge, right? So it's a simple statement, but to me, that's an incredibly loaded statement, to be willing to learn about yourself, again, as an adult, right? So we did have, of course, strengths and limitations in the study itself. So we did have standardized sessions, we had standardized assessments, we had consistent partners, we had consistent participants, we had completion of the measures, we did not have attrition, reliable data, and consistent horses. Some of the limitations. So the van drive is a stressor. They're driving 45 minutes from the VA. I think everybody in Cleveland's like nodding their head yes. It is a stressor in and of itself to drive out here. Once you get here, yay, but to get here is hard. There was some variation kind of who, the same people would show up, but we would say, like, which person are we getting today, right? Because again, it's substance use treatment and they're going through a process. And so we would get a different state of withdrawal and a different state of treatment in the same person. And it would be kind of challenging at times. And so sometimes we might get somebody who literally cannot walk in the barn. And the next week they're like, yes, I'm ready to go. And we're like, oh, okay, sounds great, right? So just meeting the people where they were at each session was sometimes a challenge. And sometimes it was like, oh, tell me your name again, because I don't remember it, because they're such in a different place. So it is a challenging population at times to work with as well. And then just the long-term impact and compounding factors, like we had school groups going on at the same time, right? Is this a group that it's okay to have school groups, going by to get their horses for their riding lesson? Like maybe, but also maybe not. There's some tough conversations happening. So just kind of in controlling your environment is really challenging too. Safety and physical space being the biggest recommendation, and partnership. So this is where I want to really pause and lean into. And like I said, this was an intervention in and of itself, and the research, and yay research, yay findings, that's important. This could not have been done without the research partnership with an institution, without your support. And I think that that's really one of the most important things. Is one of the places that research gets really hard, I find research gets really hard between centers and organizations, and then finding institutional support, right? Yeah, yes. And so what that looks like, and if you can kind of step forward and speak to.
So I think too, one of the things that I have found helpful in this study is that I am really outside of the study. I'm part of the study, but I'm not invested in the findings, right? So as you were talking, I'm thinking to myself, but Aviva, you've got a co-occurring treatment effect. How can you say that your treatment is the horses and not the ongoing treatment in the VA? So because I have that outside researcher stance, I can ask those questions without you feeling like I'm gonna blast you out of the water. Excuse me. Wait, I also bring, or our organization brings, when you have a partnership with an organization, you get like the pluses and the minuses of the organization. So CASE has an amazing research infrastructure. And through the Mandel School, where I'm a faculty member, I have access to that. So when Aviva mentioned she needed IRB, I can help with that. When we talked about the design, well, I can lay out every design in the books, and then we can negotiate what's going to fit here, what's not going to fit here. When it comes to the actual intervention, Aviva takes that lead. And I say, well, how are you going to operationalize it? How are we going to talk about this? How are you going to make sure everybody gets the same dose? So she can ask the clinical question, I can ask the research question. And then when it comes down to it, we are both invested in the outcome for the clients, the outcome for Fieldstone, the outcome for your career, my career, the outcome for the university, because having this study at the university also has an impact. The IRB has to think about the welfare of horses. They're not used to thinking about that. We have students who hear Aviva talk and say, wow, I'd like to get involved in that. Aviva had what, we had a master's student on this study. You've had 2 or 3 other students on your studies. Aviva developed and taught a course for us and is changing the curriculum. So the university benefits from that as well. Without that, this partnership between the 2 of us and our 2 organizations, I mean, we would not have a lot of different outcomes. I think also when it comes to thinking about funding, what kind of funding is available, universities have small seed grants that will make studies like this possible. because there is a university involved. Some foundations give you a little bit higher score because you've got the infrastructure there. So it is that collaboration, I think, has to work for both, and it has worked for us in a very, kind of evolving way. And as Aviva came here to work at Fieldstone, I'm thinking, great, we have an in at Fieldstone. And then as her career evolves, then you think about, well, how can we expand this partnership? How can we bring more people in? How can we get more people excited? So I think there's just many, many positives to something like this. It must be positive because here I am on a Sunday morning. So, driving 45 minutes. Yeah. So, anything else you can think of?
Well, I think a part of it too that what's interesting is, when we started 2015, 16, you were like, well, that sounds interesting. I'm going to have to go on this learning journey with you, right? So I think a piece of this, if you're at a center and don't yet have an institutional infrastructure and support, that you can make one through making relationships, right? That it doesn't have to be, you have to find, a Kimberly Cole that exists, right? Or an Ellen that exists and be like, you're my person now, right? But you can find somebody who's just really interested and open to learning and will go down this road with you in journey. And that is also incredibly helpful. While you guys are incredible assets and necessary 100%, thank you for being there, it's also helpful to find the people who will kind of engage and be like, okay, well, what is this thing? And like, let's learn this together and let's go, go on the adventure.
Yeah, that's a good point, because this was clearly a new thing for me. I mean, when I first came out here to see Fieldstone, and Aviva had me do the centering with the horses, I had to face a huge fear. I mean, this is not my game. But I have really come to learn a lot. It has been a learning journey. I do a lot of work in Poland. I'm now working with equine-facilitated therapist in Poland. We've just written a paper to have published in Poland. So it's big. I mean, it's been big. But it started in a personal relationship. It started in a personal relationship.
Yeah. And I think that was.
And you took a chance, and I took a chance.
Yes. Yes.
Yeah.
So I think that was the piece that I really, for one, really wanted to share a thank you female veteran study that had, significant findings on something that's, I honestly think easily adaptable in a partnership, right? But that also, this partnership is something that we can all engage in and do to also advance research and also advance practice, right? Because I will say that the students that I've had the privilege of working with have absolutely blown me away. They've been amazing. I had 2 students in particular who are both clinical and pushed back on I'm a social worker by training, on the NASW, so National Association of Social Worker Code of Ethics, to say that the statement around the dignity of human relationships shouldn't be human, it should be interspecies, and they actually published a paper that it should just be the dignity of relationships. And it got published. Those are my students. I was very proud of that, right? Like, that's amazing. And that's the work that we're actually all a part of and all doing. So I think that's really what I wanted to leave us all off with, is who knows where our work actually impacts people. And yes, it's a research conference, but it's so much more than that too. So, thank you. Yeah. Yes?
How many program evaluations did you do of this program over time?
Oh.
And how have your program evaluations informed the program's evolution?
So if I go with program evaluation, we've collected, we serve over 100 veterans per year in this program. We had this partnership for about 8 years. I have a file drawer full of, and it has absolutely, because we used to, you literally ran the program for a little while, right? And it wasn't necessarily those 4 structured sessions, right?
Very, very familiar with those 4
Yes.
sessions. It started out as
an 8-session
Yeah.
program. And then that was too long for the VA's program, so it got shrunk down.
It went to every other week, right? Yeah.
And so it became a 4-session model.
Yeah.
So, yeah, and we had a good bit of data that you guys probably don't have too back at the VA.
Yes.
So there's a lot of program data.
That program evaluation side, they wouldn't share. So I don't have anything from the VA's side.
Oh, they conducted the evaluations?
No, they conducted their own in addition to what we did.
And
Yeah.
did you have an external evaluator you worked with for program evaluations each year, or you do it yourself? Okay.
Yeah, I know next step would be like have somebody external, but like, no, that's me. Yeah. But it absolutely has impacted and changed and refined what we do, how we do it, what is structured, what's not. So like that idea of choice, right, that came out of some evaluations saying like, I don't feel safe in the confines of the grooming stalls. Well, okay, we don't have to be there. There's literally no reason to have to groom in the grooming stall, right? So it absolutely impacts what we do and how we do it. Yeah.
So it's kind of 2 questions.
Yeah.
Somewhat combined into one. My first question is, once the sessions were over and like I guess the 4, so it's 4 sessions every other week. You had about 10 or so veterans come in. Once those sessions were over, did their fears ever come back?
So we didn't have continued contact with those veterans unless they chose to come here as independent community members, which some did. So I would say for those, hopefully, no, because they chose to keep coming. So I don't know.
But you ask a really
Yeah.
interesting question, I think, in terms of what's the impact of the treatment, and then how long does that treatment effect last? And so the other question that I think kind of goes along with that one is, to what extent does this interaction facilitate engagement in other forms of treatment? So the only way you can really figure that out is a randomized control study, which is expensive and hard to do. But that's a really good question. Yeah.
And then my other question is, so you had mentioned back, I think it was like in the beginning of your presentation, so you said that you would have to, again, the same 4 sessions, and you would say that the same-ish veterans would still come back. How would you figure out which part of the treatment process they were in?
So they're in an 8-week session, and they're following the VA's session. So yeah.
So would the VA just, you probably, I don't know if you
Yeah.
can say this or not, but would the VA just tell you, look, they're in this part B of the
Yeah. They wouldn't.
process?
They come in a cohort.
Yeah.
So it starts with 2 people every 8 weeks.
Yeah.
Maybe at the same point withdrawal.
Yeah.
I think was-
Yeah.
Yeah.
But how would you figure out which part, I guess I use a bad
No,
language.
you're okay.
But, like, how would you figure out, I don't really know how to, but like, part of the process, like a withdrawal, like you would say that some would come in, oh, I don't want to do this, blah, blah, blah. And then the next session, I guess, the person would be like, oh, this is great, let's
Yeah.
go pet a horse.
Yeah.
So how would you figure out, because I know with withdrawal, it sucks.
Yeah.
Pardon my language, but
Yeah.
it sucks.
Yeah.
I've gone through it, and it sucks.
Yeah.
So how would you figure out which process?
Yeah. So I think
Where they were at, really?
personal. So as the person in the session, I didn't really think too hard on that, to be honest. I met the person where they were at walking in the door, and I knew what we were doing today.
Right.
And I tried my best to get them to engage as much as they were comfortable. It's kind of like if the person walked in with a stomachache or a headache on any other day, and I would be like, okay, this is what we're doing. Like, are you willing to come along for the ride? Yes, no. I didn't really process, like, they're in withdrawal and this is where they're at, you know. And so the social worker would tell me today is a hard day, right? If I would get today was a bad van ride, right? And I would know that. And I would know where to meet the group at. But outside of that, I really just met the person where they're at and not so much ever really internalized what was going on at the individual level unless it was a safety risk.
Now, from a research perspective, I'm a firm believer, if you have enough time, money, and expertise, you can measure it.
Yes. Yes.
So, I mean, if that were part of your research question and you really were interested in that, you'd figure out a way to measure time from last use. You'd have a withdrawal measure. You could also look at a stage of change framework in terms of what am I ready to do today?
Yeah.
So you'd have to build that into your design. It is what we didn't build it into this one, but you could do it based upon your research question.
Kathy.
So am I correct that this partnership started because you were a PhD student? Is that
No. This was, I'm at Fieldstone and I get to do research, yay.
Because I'm thinking of it from other centers' perspectives of how, what would be your recommendation on how they go about creating a partnership with a higher?
Yeah. So I've had a couple people come up and say, I want to do research, right? And so the question is, what, you might want to speak to this more than me, but it's really, do you have an existing relationship with an institution or a faculty in a department that makes logical sense?
Right.
And if not, who's close and how do you make that connection, right? Who can you pick up the phone to? And if not directly to a person, who do you know who knows somebody, right? And that's really...
Yeah, in our case, it was really serendipitous. We met through a third person, my colleague from Poland, who came to give a talk on animal-assisted intervention. And so she met you at, I think, somewhere. And so then the three of us got to know each other, and it just kind of happened. But I think, though, you have to remember that organizations like the Mandel School, we're always looking for field sites. We look for places to train students, we look for places for our doctoral students to get involved, because we really want to push the research knowledge base with a community partnership. Because it's all about what actually happens with clients. So I think that if you're an organization looking to develop a research partnership, it would be a call to the dean. We have this, a call to the field department. If you happen to know anybody on the faculty who's interested in this kind of thing or who might be open to it. And in this study, you could approach it through equine-facilitated therapy, substance use disorders, trauma disorders, which are big, work with women. So there are a couple of different ways to pitch this to get people interested in it.
Thank you.
So some of you may know, some of you may not know, that on the Horses and Humans Research Foundation site is a free checklist that I had developed one, and then Robin Gabriels had developed a separate one. Caitlin Peters adapted hers. We combine all three. And it's really set up from the center perspective, but it's also a tool for academicians. Because as you are looking for projects for them, you need to make sure that you can kind of walk in and get a sense that Fieldstone is not operating on a shoestring and they've got some capacity. But that's not easy to assess. A smaller organization may actually have more opportunity because they're not this big even. But there are things that both the potential researcher and the academic organization and the center can do to maximize the success. And that's free. You're welcome to use it. But I just didn't know if there was.
That's a good tip.
Is it still research readiness checklist? Is that still what it's, yeah.
That's a good tip.
Kimberly?
Thank you.
One of the things, and I had a question for you as program director, but also interested in research. So we've talked a lot about IRBs.
Yes.
But one of the things that we have as an institution is Institutional Animal Care and Use Committee.
Please, thank you.
So that it's hard for us to partner with centers
Right.
or farms, because for our university animals, we have protocols that we have in place for how those animals are cared for.
So,
But not
Yeah.
all centers do, so sometimes it's very hard to utilize animals at centers if we don't have things in writing that we can submit with those animal use protocols.
yeah.
Simple care and feeding.
So I'll tell you in all honesty, so that rating and anxiety that I talked about before, we went through the NYU IRB and we told them exactly what we were doing. And because it was the therapeutic riding as usual, they said, you don't have to go through the animal care IRB. No, because that, whatever. We are having such a hard time getting the published, even though we're reporting back in writing what the IRB said, because we didn't go through that initially. If you are doing EAS research and you are partnering with an institution with IRB, please listen to this recommendation and go through with the animal care as well.
You can get it exempt.
Please.
You don't have to.
Yes.
But you still have to get a letter from the IACUC committee stating that it's exempt and they assign
Yeah.
the protocol number, but you have to have it.
Like, if you plan on doing research and publishing and doing an IRB, please.
Okay. Thank you so much.
Yeah, thank you.